Good afternoon and good evening, everyone. Welcome back to the 7th Annual International HitLab Innovators Summit. If you're just joining us here today, would you believe that we've already had over 13 hours of content, starting all the way from 3:30 a.m. Eastern Standard Time this morning? Our team in India was working hard to put together sessions and panel discussions. Now that we've concluded what we call the EST part of our agenda, we'd like to welcome you to what we call the West Coast Hours. And kicking off the West Coast Hours, we have our next panel discussion titled MCT Wellness, Billable at Home Movement Therapy Solutions, accessible for everybody, presented by the team at Playing Forward. We are so excited to welcome moderator Guillaume Poirer, Clinical Scientific Advisor, and panelists John Attard, co-founder and CTO, Darren Hawking, Chief Scientific Advisor, Harut Mardirosian, Unity Developer, Nicole Mosier, VP of Business Development, Brian Bertha, Healthcare Business Development, and the rest. Thank you so much, Playing Forward, and welcome. Thank you for joining us.
Thank you.
Hi, welcome everyone. Thanks for joining us. I think we'll just dive right in. And really what we'd like to do first off is maybe give an introduction to Playing Forward. John, maybe you could take that?
Hi, thank you. Thank you everybody for joining. I mean, a lot of what Playing Forward is in the name. We're called Playing Forward for a reason. And the focus was really that my background and the background of my co-founder was in entertainment, and we'd both been doing that for numerous decades, as you can see from the gray hairs in my beard. And my co-founder Victor in particular had a really strong focus on developing things that were helpful to children, and we focused very much on social emotional learning, and we started to develop technologies and applications for children in that field. And then quickly, as we started developing technologies and we started interacting with various people in the healthcare industry, and in particular Darren, we started to look at how we could potentially be taking some of the technologies and how we could develop technologies to assist in some of the areas related to therapy that could be augmented by what technology was allowing us to do today. And an example of that is the technology that we're launching at the moment, and the technologies that we're developing. In particular, we have a mobile based motion captured and motion assessment tool, which provides us objective movement data, which we analyze with artificial intelligence, so that we can recognize and categorize those movements, as well as creating an experience which is individual for each one of the children. So we're looking at children, we're understanding how we move, we understand what the connotations of that movement is, and we also very strongly understand that those children are all individuals. So the system needs to be able to adapt to each of those, to each of those children. The story so far is we've created 2 VR games to elicit movement. What we call an insinuation game, where we have a scenario in which we insinuate movement by putting them in the scenario, and a mimicking game where we're basically mirroring, and in that the child is involved in a dance game. And we did an IRB study around that, and Darren will be able to tell you later on a little bit more information about how that IRB went, and what we learned from that, and how that has affected our development moving forward. We were also very fortunate to collaborate with LA Children's Hospital, and we took part in their hackathon, which we're very pleased to say we won. Also, we've been very fortunate, and partly due to our entertainment background, is that we understand one of the biggest issues that we're trying to deal with, and especially now that we're post-COVID, is this idea of being able to get therapy to children when they're not in the clinic. And before COVID, it was a very big problem. Just the number of children, number of resources necessary were just didn't match. And now post-COVID, where there's even less availability, the idea of getting children to engage in physical exercise or physical activities that are therapeutic in nature is difficult. And so what we're doing is we're leveraging very much our experience in, in feature film and video games to create experiences that, that to them seem to be fun, playful exercises, but are actually therapeutic. And we're very happy that part of that, to help us with that, we've been working with Nickelodeon, and Nickelodeon have assigned some licenses to us to allow us in our current testing phase and test and learn that we're engaged in at the moment to use their characters and to increase, both adherence to protocol, but also frequency of the exercises. So, the other kind of major thing that's happened in 2020, like every other company, COVID has changed the landscape. And so one of the things that my colleagues are going to be talking about as well today in a little bit more depth is we've taken a lot of the technology that we developed for VR purposes, and we thought, how can we get this to people now that are cut off from any opportunity to exercise or to get data about what their physical and cognitive capabilities are. And so we took a lot of that technology and we put that on the phone. So we have an app which we've just released on the Apple Store, which allows you to do just that. And we are also about to release a specific version for the holidays, because unfortunately, as I think everybody listening will have predicted, this holiday season, COVID numbers have increased. Stay-at-home orders are appearing everywhere. I live in California. That we've just been given our stay-at-home orders, and so a lot of people are going to be homebound and not able to engage in physical activities with others. So one of the things that we've done is, apart from taking a lot of the technology, making it accessible, we've created a small package that we're going to be releasing for Christmas time to take a little bit of the edge of that kind of isolation and make it fun, entertaining, whilst at the same time healthy for the child. So that's kind of where we started and where we are at this point.
Very nice. Thanks for that overview, John. I think you mentioned a few things between what's about to be released and some of the past experience. Could you maybe go into more, tell the audience a bit more about what the reception has been with the past products and what you've released up to now, and what you've tested, what the user experience has been?
Yeah, actually, I think probably the better person to answer that question would be Darren, as he headed up the work that we did on the IRB study. Actually, Darren, if you want to take that one.
Thank you. Yeah, so some of the original work we did was to test really the feasibility and acceptability of custom designed VR entertainment video games used to improve motor skills, particularly gross motor skills. And we focused on children with high functioning autism spectrum disorder. And our first initial feasibility study was to do a 2-week trial of 6 sessions for 20 minutes of a gaming session. And some of the motivation around this was that we know that the core domains of diagnostic criteria for autism are often social and communication restricted behaviours, but motor skill difficulties are widely acknowledged as pervasive features in children with ASD. But the access to interventions that are motivating, accessible in the home, and uniquely adapted to the needs of these children is often very limited. So we combined a low-cost motion capture system with a customised immersive VR dance game, where OT prescribed movements were modelled by an interactive character with an entertaining narrative and backstory. We also trained a machine learning algorithm to track fine-tuned changes in the kinematic movement, which then automatically adjusted the game difficulty so that the child was constantly at a maximum challenge level for their level of ability. And this closed loop system really allowed us to adapt the level of difficulty to the child's individual performance, so that challenge was customized in a real-time continuous performance feedback cycle. And so the child's constantly challenged in this environment. From this feasibility study results, we were able to show that that this system was safe and feasible, and parents and children reported high levels of engagement, enjoyment, and acceptability in the system. And the quantitative approach that we use from motion capture to derive these motor skill and spatiotemporal categories also correlated with our gold standard assessments that we use for motor skill and autism symptom severity. So we're able to also show that these AI-derived metrics were correlating with gold standard measures. And essentially this study really, I think, set a benchmark for combining neuroscience-informed game design principles with the customizability of entertainment-driven game environments.
Yeah.
Sorry.
No, go ahead. No, I think it's fantastic to have that first demonstration of acceptability, right? Not just demonstrating the feasibility, but showing that, especially in that population, that it was well received, even in VR, right? How, you mentioned, John mentioned earlier that the current context of COVID also brought in some new developments in terms of products. How has COVID in the current situation and pandemic stay-at-home situation, has that altered any of the plans, or what can you tell us about that?
I mean, I can jump in with that, and then maybe Harut, we can sort of talk about what that meant from a development perspective. But as Darren was just saying, our initial work was very much focused around virtual reality, and virtual reality is as excellent a tool as it is. It does require very specific hardware, and so we have three components to simplify. We have the virtual reality component. We have the application running on a thin client or mobile device, which your phone or your iPad, and we have the artificial intelligence. The way that we were building things pre-COVID, we were building things at a certain pace. But when COVID happened, what we realized is that what we felt was that that we could remove one of the barriers, and one of those barriers was the necessity to use a VR headset. You can still use a VR headset, but it's not a necessity. And so we focused very much on shifting a lot of the artificial intelligence compute either to a server or mostly locally to the device, and then and then move a lot of the activities onto the device using screencasting and in a very soon to come release front-facing camera. But I mean, you could speak more to, I mean, all of that whilst adding a whole series of content which we're designing with Nickelodeon based on SpongeBob SquarePants, the Teenage Mutant Ninja Turtles, and Dora. But to really tell you what the impact is, I think, Harut, if you want to talk about how we modularize things and how we approach the product, that I think that would be helpful for Guillaume's question.
Right, of course. So in light of COVID, limited accessibility to therapy solutions, like going to the office, and the hardware solutions, having a PC that could run the VR headset and our software, really moving to the mobile phone was the next big step for us to take. Luckily, and a little bit of a forward thinking on our part, the way we build our software is, highly modular and data agnostic in a way. What that really means for us is you can think of them as Lego pieces. You can pull out the pieces that are unnecessary or you want to switch out. In our case, we pulled out the PC, and VR components and replaced them with a phone and the back-facing camera for the iPhone. That data that we still get is still fed into the motion capture and to the AI, just with minor tweaks. And that really provided us a quick solution to getting it to the mobile phone and give accessibility to this product to a wider audience. What that really means is that experience that we gained from the VR headset, from all the studies that we've done, were quickly ported to the phone. And kind of to look to our future, because that we kind of always do, right? Playing forward, we're looking forward all the time. Is that what does that data do for us, and what we can do with it? Like John alluded to before, we can tailor these experiences to the individuals that are using it. Whether that means if we look at the domains that they might be lacking in and provide them with prescribed movements that could help them, shore up those domains to be stronger with their balance or their sway. Or maybe if we know that they particularly like playing with SpongeBob. We'll give them more SpongeBob activities and increase the frequency and their engagement with the app to make sure that they're always finding the time to play with it and improve their overall wellness. Again, with the camera and the data agnostic solution, we can move forward to changing it to the front-facing camera, allowing more people to play it solo, or moving it onto an Android phone, to webcams, web laptops, really making sure that we have this application that's accessible to everybody.
Yeah, that's great. So that you've maintained the adaptability, or the adaptivity rather, of the movement according to performance. You've maintained the entertainment, and you have it in a package that's light enough to be able to function on anybody's smart device, essentially, right? So I guess here it wasn't because of challenges in acceptability, for example, right? In your feasibility study, this is just a case of enhancing accessibility, right?
Yes.
Yeah, and I think that Harut's making light of the job that the guys did there, but taking what our original product, which was for the IRB study, which was a very powerful PC that was running a Microsoft Kinect camera that's specifically focused on motion capture, and a HTC Vive headset, and taking all of that work that was being done and then putting it onto the phone was a very big challenge, and occupied a very big part of the initial part of this year, especially post-COVID, where we went from a desire to, we absolutely need to do this if we're going to address this, what we knew at the time would be a longer term problem than some people were announcing on the news, and be able to playing forward as a company that's focused on helping people and kids in particular. And so the challenge of taking all of that and making that available on the phone was a large one, but we're very happy to say that we have a app on the App Store that's doing everything that our $15,000 rig was doing in the IRB study.
That's very impressive. Yeah, thanks for emphasizing that. I wonder, you talked about how you have movements, you might have some suggested movements. There's that entertainment component. So in terms of the user experience, right? What does that boil down to? What is the user seeing, or is there anything that's reported to the user, or they're playing along, they're getting these movements? What does that mean in terms of their own user experience from their side of things?
I think so. Nicole Moser, if you want to take this one, and maybe if you can give everybody kind of like a walk through the user journeys of what they can currently experience in the app and what we have planned for the immediate future. I think that would be the best way to answer that question.
Yeah, absolutely. Thank you, everyone. So I want to start first with just a little bit of information. So prior to COVID, 16 million children are requiring physical therapy. And so we definitely have a problem. Of those, 70% of people, that includes children and adults, don't complete their physical and occupational therapy sessions as prescribed. So when we were looking, even again, prior to COVID, we were looking to solve the issue of accessibility, affordability, compliance, and engagement. And so we built a motion capture technology that was able to be used to create an immersive and fun experience in clinic using VR. And you heard a little bit about that with the IRB study and everything. Specifically, the technology itself, the motion capture tool, captures 70 different measurements from head to toe of the user. And for each of those measurements, it gives real data about the rate of change, the levels of improvement capability, and the movement itself that the user is doing. And so all 72 of those measurements are captured in real time each time the user has a session. And so what I want to walk through is just an overview of the application itself. And I think a lot of those questions will be answered. So we took the motion capture technology that we were previously using in VR and figured out a way to port that same technology into a cell phone on an app that is in the App Store, but also it's free. And so when you go and you download the MCT Wellness app, you'll find that there are 3 user journeys. We looked at our target market in 3 different groups. We have those of the therapists that we were previously already working with, who prior to the MCT did not have the ability to measure improvement in their patients. Most improvement in physical and occupational therapy is a visual observation. So we were able to create a tool for them that quantified improvement and gave them real-time results in every single session that's done, so that they can look back and see that little Johnny has improved his range of motion on his right arm by 8% over the last 3 days by doing exercise A, B, C, and D. They hadn't previously had that access to that information, and that technology wasn't available before. And we've tested that in clinic and got fabulous results. So we have that of the therapist. We have a regular user who would be using the application at home. And we also have a caretaker, and we look at the caretaker as parent with children, or we look at it as adult taking care of an older adult who's probably in physical therapy, maybe due to a fall or due to loss of range of motion, things like that. So when the user goes in, we ask them to create an account, which includes their email address and a login. And within their account, they're allowed to create a profile. So if they're a single user, they're creating their own personal profile. If they're a caretaker, they're creating profiles of, for me and my 3 kids, or for if I'm an in-home healthcare provider, maybe 5 patients that I care for throughout the month, right? And that way I'm able to access every single profile within one account, one user login. The therapist has the ability to add an unlimited number of patients so that they can have an account for each of their patients. Now, within the app, within the account and the profile level, the user is able to then go in and they can do recommended movements. They can do free move. And we're also going to have a low impact dance game. And that is going to be live in the next week or so. And again, at no additional charge. So when we started this journey pre-COVID, our intention was to reach physical and occupational therapy patients. We now have looked at this journey a bit broader in the fact that, wellness is something that everybody is trying to accomplish, and it looks a lot different since COVID. And so moving our body is something that keeps us healthy. We all know that, but when we can quantify it, it makes it even more impactful. Thus the reason for the different user journeys. So we target the individual user, and if they go in and they play recommended movements for the first time, what we do is we give them a set of 5 recommended movements that allows us to establish a baseline for their body. Our artificial intelligence and machine learning then makes recommendations based on their performance that are specific to them. And so that the next time they go in and do recommended movements, those movements are actually tailored to their body. This is one factor that differentiates us from any of our competitors. There are similar people that are able to track movement, but none that are able to measure improvement, none that are able to measure the rate of change over time for a particular body. And so we're kind of in a blue ocean in that respect. So each user, no matter if they're an individual user or a caregiver or a therapist, once they do a session in recommended movements, they get real-time results. And that means what they get is the readout of 72 different measurements of their body for every single movement that they did. They get those instantaneously in app, and they also get them in an email. One thing that each user has the ability to do if they're not a therapist is to add a therapist email. So if they are in fact seeking, receiving occupational and physical therapy, they have the ability to have their results automatically sent to their doctor. And that'll happen every single time they use the app. So that's the recommended movements. For our therapist, we've designed a section called Free Move. So our idea is that if the therapist is in clinic or even in a telehealth session, they can have the patient use Free Move and tell the patient to do particular movements just like they would if they were in clinic. And then what happens is they get instantaneous results of the user's movement, and they get all 72 of those reads and measurements of their movement, their improvement, and the comparison of their movement to their prior sessions. So they're able to measure improvement over time. Within the application, we're also building a game store, which is going to feature different things like a yoga store or a yoga class, low impact cardio. We're looking at PE for kids, and a cardio dance class, fun games that are targeted towards wellness, but each of those sessions will still give the same data readout no matter what they're doing. So if they're doing a therapeutic session, they'll get the measurement of all their movement. If they're just doing a dance game for fun, or if you have kids and they're trying to get them to run their yayas out and you have them do a dance game, we still get the readout of their measurement. And our goal is to make this a fun tool for them to use. One thing that I want to highlight that we've been able to do really well with our application, John mentioned the use of the forward and rear facing camera on the phone, but we also have the ability to screen mirror, which means that you can connect your phone with your television set and actually see yourself moving on TV. This is particularly ideal if a therapist is doing a telehealth session with a client and wants to watch them move. All you need to do is, if you're on your laptop, point your laptop towards your TV and the therapist can tell the user exactly what to do. And then automatically they will get that data emailed to them or instantaneously in-app. Another feature of the application that I want to point out is that the therapist will have the ability to share a profile with a caregiver or a single user, and vice versa. So if a user creates a profile at home and then goes to their regularly scheduled session and the therapist has never used our app, the therapist can download the app, the user can share the profile, and the therapist will get real-time data updates every time the user uses the app. And if the therapist sees the child for the first time, has them download our game and play in clinic, they have the ability to send mom or dad home with the app and share the child's profile as well. The data sharing capabilities are really something that is going to, I think, fare well, but be a very important tool for us in the future. We are also in the process of building in recommended movements that the therapist is able to manipulate. So if a child goes to their regularly scheduled therapy session and the therapist wants them to practice 5 or 6 recommended moves at home, because typically that's what happens, they have the ability to actually program the recommended movements for each user profile or patient profile that they have on the application. And so if little Johnny goes home and he's supposed to practice balancing on one leg and doing jumping jacks or maybe doing the tree pose, the therapist can see not only how frequently little Johnny's practicing, but he's also going to get the real-time data of how little Johnny's body's improving every time he uses the app. And the next time that he comes into session, the therapist can program new movements for him to work on. Those new movements can also be programmed at any time and updated in the user's application. Some of the features that I'm highlighting now are in progress. Our team's working on building them, but this is how the app is going to work. Many of these are available now. So we look. Oh, I'm
Yeah.
sorry, go ahead.
No, I was just going to say, so you're clearly investing a lot in making, collecting the data and quantifying movement, right? Which is, as you're pointing out, a bit unusual, that you're not just tracking, oh yes, the person used the app today, right? It's all about the specific movement, about whether it's upper body, lower body, or left, right, which limb.
Exactly.
And
Exactly. We're able to isolate different pieces of the body and look at the measurements for that particular. If you just want to look at, how the motion of your right arm is improving because maybe you broke it, right? We're able to isolate just the measurements for that arm and work on improving those and see how they improve over time based on different exercises that the user is being prescribed to do.
right. So you mentioned prescribed. I think you were, part of the emphasis maybe accelerated with COVID or with the pandemic was to make a product that is accessible to all. You said yourself, it's now on the App Store.
Mhm.
So how are you juggling those two sides of the wellness, and how does that feed back into the therapeutic side of things? Maybe Brian, maybe you'd like to answer and elaborate on that, and maybe Darren after can add some comments, please.
I'd be happy to. I don't. Nicole, does it make sense for you to finish where you were, and then for me to do that, or would you like me to jump in?
I think I had one more piece that might actually help you segue right in.
Please,
so,
then continue.
no, that's okay. Guillaume, to your question. So we look at this not only as a wellness application, just like you would look at Nike Fit or something like that, but we look at it as a tool for therapists. So just as Nike Fit, people are working out at home all over the world right now because that's just what we're limited to. But for the first time, you're able to actually get real body recommendations with our artificial intelligence and machine learning. We're able to make real-time recommendations. And again, that AI and machine learning is constantly learning, and it evolves every time the user uses the app. So we're always focusing on getting better. And that, from a wellness side, that really, again, sets us apart because the user's getting information on their own body. If I do a Nike Fit yoga class, it might be a lovely class, but they don't know if I took that class while sitting on the couch eating bonbons. Our app tells you how you moved in comparison to how you were supposed to move and how you can move better. And so from the perspective of a therapist, it's a tool just like any other tool, just like a balance ball would be, just like a 5-pound handheld weight would be. It's a tool that they can give the patients to practice their movements at home. And it happens to spit out data that tells the user how they moved. So Brian, take it away.
Thank you. It's a good transition. So, so Nicole talked about the app as a potential wellness, more consumer facing and used by consumers and OTs. I'm going to touch a bit more on how it fits into a more traditional healthcare system, where there needs to be a series of benefits. There needs to be an overall system benefit, meaning healthcare generally is served better. But the stakeholders as well need to benefit, right? The payer is able to better manage care that's equal or better care at a lower cost. The clinician or provider, in this case, generally the occupational therapist, PTs as well, but we'll use OT as the most common example, are able to provide services as well or better with some advantages. In our case, they can do it remotely. They can provide service between visits. They have the option to provide service when visits are not possible, case in point during a pandemic. And really important, they're not economically disadvantaged. They're not losing money as they adopt or incorporate this new service. So the system has to benefit the payer, the occupational therapist. Now, of course, so does the patient. And I think Nicole's elaborated on this well, the potential benefits the patient can get. They get the benefit of equal or better care with fewer visits to an actual office, which means less time, less cost, copays, less potential risk of exposure during a pandemic. And of course, that benefit also, since most of these patients tend to not be able to get themselves there, the caregivers benefit from the convenience, travel, not missing work. So I can elaborate on that a little bit. Let's let's think of an example where a typical OT, and there are no typical OTs, but this is a representative example that we've seen in several offices where a typical occupational therapist might have 25 to 30 slots during the course of a week, roughly 25 to 31 hour slots. And some patients they see every week, some that they see with less frequently. But to make an example really simple, let's just assume that they see a patient once a week, which is not uncommon. And let's assume that that occupational therapist has 30 slots and they see the patients once a week. That means they're seeing 30 patients. And in the course of a month, to keep it simple, let's call it a 4-week month. They've got 120 slots that are basically 30 slots each for 4 patients. So that's a very traditional model where the patients come in and they are getting this dynamic functional therapy with the occupational therapist. And they're billing with a very conventional code that basically is 4 15-minute increments that generally is somewhere in the ballpark around $80 of what payers pay. Okay, that's just there's a broad range. That's not an official average, but just for argument's sake, that's about in the neighborhood. So if they were all paid for by payers, that's about what they get paid, $80 times 30 for the week and times 120 for the month. Now let's just say that in that clinic, because of the tools that we have, that they can actually say, you know, we can do some remote patient monitoring, and a patient only needs to show up 3 times a week. I still have my 120 slots, but instead of 4 patients spread over that, and I can only service 30 patients, I now have 3 patients. I'm sorry, I now have 3 slots for each patient. And so in theory, if there's no monitoring, I could actually add another 10 patients. I go from 30 to 40. But of course, there's time looking at the data and thinking about it and being educated, and they get paid for that. They're actually required to interact with the data, look at it, and have some communication with the patient based on that for it to be billable. And there is some different time increments. If you look at the different bills, it range from 10 to 30 minutes. Let's call it 30 minutes for simplicity's sake. Then basically, instead of adding 10 patients, they're now adding maybe 5 patients. So in that hypothetical 4-week month, they've now gone from 30 to 35 patients that they are able to give equal or better care. And what's happened? Well, what's happened now is the payer is, again, once we've collected the data that shows this, the payer now is able to provide the same quality at a lower cost, right? Because now for each of these patients, they're paying $80 times 3. They're saving $180 visit. The remote patient monitoring typically bills around 60. So they're saving something, 20 or so dollars per patient per month. By the way, the typical return that payers generally look for is about 1 to 1.3. So if they break even for better or equivalent care, they're typically happy. So already we're showing a benefit to the payer. And in addition to that, the payer has the benefit of being able to offer the patients they manage options that allow remote care. Think conditions like pandemics or rural patients. So the payer is better off from a cost as well as a provision of care. The OT is actually getting more money as well, because he's now seeing more patients. Each of the slot that he's visiting patients, he gets the same amount, but during the remote patient monitoring, they're getting $60 or more for what is no more than 30 minutes. That's $120 an hour. So for the time they spend reviewing, they're actually getting paid more. So they're getting a slight increase in pay. They're able to service more patients using the benefits of these tools, which we've heard John and Hassan elaborate on, and Harut elaborate on how the tools are making a lot of decisions and giving a lot of input. So it's highly effective, that the personalized type of care that's being offered as they're getting paid more and servicing more patients. So we have happier OTs as well. The patient has the ability now to not go to the office as well, which also gives them the option of continuing care between office visits. And I think something that we hear a lot about throughout the medical system is the value of the frequency of care, right? If the provider doesn't find out till I see him or her in a week that Jimmy hasn't been doing their care, they can do something then, but we've lost that week. But with these remote systems, they know immediately. The system you heard Harut and John talk about will immediately send a text to the caregiver, something didn't happen, a treatment didn't occur, a therapy didn't happen. And if nothing gets done after that, depending on how the OT decides to program it, it might escalate with a message to them so they can give them a reminder. The same way we occasionally get reminders from our dentist saying it's time to go to your checkup, you could imagine a reminder saying Jimmy hasn't engaged with the technology in the last 48 hours as intended. So there's those abilities to keep, and Nicole talked about this goal of frequency and reminders. And of course, related to the patient is the caretaker or the caregiver. Most of these patients are children, at least in some of the areas of care that we're focusing on, such as autism. And the caretaker now saves themselves a drive. The caretaker is now being reminded automatically by the system if someone's not engaging as they should. The caretaker does not have to report to the OT what happened that week. The OT already knows it. The OT's already had the information summarized through the systems you heard John and Harut talk about, with potentially some very smart ordering that lets you know whether the patient's in or out of parameters. And in addition to all these different stakeholders I mentioned, the payer, the OT, the patient, the caretaker, you just generally have better care because they're getting higher frequency, they're getting more personalized care, they're getting constantly the type of therapy is being altered and modified by the patient's own desires and interests, the type of game, type of color, sound, characters, therefore creating a better experience and a virtuous cycle where they're more likely to engage and do the exercises that we know create better therapeutic results. So all of this is why we think this is a very desirable system that is good for all the different stakeholders and will yield better care overall.
Yeah, thank you, Brian. I think you finished with I think one of the important notes about not just getting better data, more refined data, both from the patient perspective or the individual perspective and the clinician's perspective. But I think the emphasis and part of the aim, right, obviously of playing forward is that it's something that the individual will want to continue and persist, right? Because it's going to be entertaining, it's going to be fun, right? So it's not just that you have this, as other digital health means, you have continued data or even live data that can be fed to the clinician, but it's something that the person will want to do. And I was wondering if maybe either yourself or maybe Darren can speak to that value of entertainment, of bringing that in with the therapeutic aspect, right? Because it's not simply a gamification of the therapy of proposed moves. You're not just saying, oh, you should do these prescribed movements and you get points for doing them or something, right? The movements themselves and the intervention is entertaining and is a game. And what can you speak to that, Darren?
Sure. Thank you. Yeah, I think from our perspective, from the work we do, we're often working with children with sort of poor attention issues with behavioural issues and other repetitive behaviours. So the difficulty is engaging those children in long periods of intervention and keeping them continuing and practicing those skills and adhering to the protocol. So the value that we see in that is that entertainment and particularly if we're talking about Nickelodeon here, but branded entertainment, recognizable characters and customized sort of environments can then build social emotional kind of loaded play behavior. So engaging them in the variability of practice and play that comes from engaging with those types of environments, so that the environment becomes an emotionally rewarding activity rather than a monotonous sort of practicing of skills over a period of time, which often children, whether they're typically developing or atypically developing, will struggle with. The other thing that's an advantage with using these types of environments, I think, is to stimulate cognitive challenge. We know that these type of environments where there's a cognitive challenge, and that cognitive challenge is at the right level in terms of the flow state of that individual, that it matches their ability level, but doesn't under challenge them or over challenge them, keeps them at that cognitive challenge level, is known to stimulate other sorts of changes in cognitive abilities alongside motor ability. So building those essential skills that children need to function and move, such as inhibiting inappropriate behaviors or switching between tasks, keeping things in mind to be able to perform different activities in different environments. So the entertainment then becomes a vehicle to that, rather than just a vehicle to keep children on the game and keep them continuing with their exercises. It becomes an emotionally rewarding activity that then drives those therapeutic changes in both neuromotor and cognitive systems.
Right. So yeah, I'm glad you brought that up, because it's often, probably too often, that these domains are kept separate, right? You have maybe some physical intervention, and you have some, mental health or cognitive intervention. And, as you pointed out, notably in this population where you did the clinical study, that these are interrelated. Where, maybe this is, as a group, where do you see the future for this, right? You talk about some physical, you talk about cognitive benefits, increasing accessibility in general, particularly in times of pandemics. What can we expect from playing forward?
Such a big question. There's so many things that we're so many things that we're doing, and so from the and also picking up a little on what both Brian and Darren were saying, right? So there are, when we talk about the application from the wellness perspective, so the children or we say children because we're so focused on children, but it really is for everybody that have access to the application, and they can engage in activities that are healthy for them. They're fun activities that involve movement and very specific movement. For example, all of the and as I alluded to earlier, this Christmas as a kind of a gift to everyone for the Christmas period for COVID is we're releasing a bunch of dances that people can play for free, but when they're playing those dance games, they're actually engaging in a series of movements that are traditionally associated with occupational physical therapy, like jumping jacks and even yoga tree poses and those kinds of things. So, but as a mechanism, having the app out there, having it be fun, having it be something that's collating information and it's building a baseline for every single user moving forward, and being something that we can try and make as ubiquitous as possible. Just like having a heart rate monitor on your watch, something like that, and using entertainment to drive people to that. What that means is with the parallel work that we're doing in healthcare, that kind of sets creates ground data and ground information that we can feed into our healthcare studies. But also, if, for example, I'm engaged in activities on the application because I'm just enjoying the activities, I'm a big fan of SpongeBob SquarePants, for example, and I'm doing a wiggle with SpongeBob there, and then something happens. I'm prescribed as something, or I have an accident, or I'm diagnosed as having a cognitive issue that's affecting me cognitively and in my emotion, as Darren was saying, the relationships. If I then at that point, as a user, somebody's already within the wellness sphere of the use of this application and the data gathering and as Nicole was mentioning earlier, the evolution and maturation of the AI and machine learning. When I then connect with a doctor, an occupational therapist, a physical therapist, they're connecting into something where data already exists, and so then I may partake in 6 weeks of the prescribed and insurance company approved duration of my therapy. But then beyond that, I get to continue doing those things. It doesn't end when the insurance money ends or the time of my therapist ends. It can continue. So our aspiration is that in general we could become a central point for the neuro movement based and health and wellness, whether that be to deal with a specific issue, putting it into the medical domain, or whether just in general. I'm one of the founders of the company, but I'm also somebody who needs to exercise, and like any other human being, having something where I can actually understand what it means when I do something. I'm not just doing an exercise, but the system is telling me, you did this well. What are the connotations of the fact that you did that well? You're really, really good at that, but you don't have an issue with that. You should focus on this other kind of exercise. Gives me a whole other kind of purpose to what I'm doing. And so I think one of the aspirations of Playing Forward in general, and how we're developing these parallel experiences where we have a wellness track and we have a health track, is so that we can in general improve or give everybody the tool to improve their wellness, whether they're in dire need, i.e. they're being followed by a medical practitioner, or whether just in general for maintenance. So I think that one of the things, Harut, one of the things that we got happening in the new year is we have an overhaul of how we're going to be making the information that we're gathering in wellness available to the medical community through a dashboard. And so, I mean, Harut, do you want to talk just for a couple of seconds on I know we've not got a lot of time left, on what we're doing as far as the database is concerned?
Sure. I mean, we are collecting all of that data from all of our users. And the best way to use that data is to give it back to the people who know how to use it the best. It'll go back to doctors, OTs, PTs. And again, it's going to be a data-driven, objective view of a person, like holistically, and focusing on upper, lower, whatever parts that the doctor wants to look at, and really give back, a data-driven method to diagnose someone. And again, it's not meant to replace anybody. It's another tool. And that tool is going to be backed by, hopefully, someone really using this app for months, years on end, and giving them everything that they need to, zone in on a problem that they might have, or provide better feedback of how, you might want to have some weight loss or a better gait. I think that the data really drives that, and giving that to the, everybody really provides us better wellness, better health.
I think that one of the things that is going to be a big differentiator for the healthcare is that the app is very specifically focused on adapting itself to each individual. With the database and with the dashboard that we're going to be creating for the healthcare community, it gives them an opportunity to look at that data on, ever increasing, the sample sizes. And so outside of gathering information from an individual perspective, then we can start to take other considerations into diagnosing or looking at what's happening in a hospital, in a county, or in the country as general, or on the planet in general. And as we know, unfortunately, socioeconomic realities and zip codes can have a massive impact on people's health. So being able to see that will help us diagnose that and help us create better systems and services for that. And in particular, right now, COVID, one of the things that we've added to the application as another gift to our users is we have a Cova Tracker, which basically tells you, you live in this zip code, therefore you're in this county. What are the infection rates and what are the what's going on with COVID around you, so that you have that piece of information. So I think that one of the things that's going to be a really big part of 2021 for us is expanding that data from the singular use case in wellness to the kind of the communal use case for the healthcare provider.
Right. That's a very interesting point looking forward. I'm wondering, and just as a reminder maybe to the audience, that we can take some questions. Happy to answer those. In the meantime, if there's a product on the App Store, there's going to be a new release. What are some of the questions that you're looking to answer right now? Nicole, Harut, what do you think, when you start getting these people using this right away, you think, oh my gosh, okay, this is what I want answered. This is a big question that we need sorted.
Yeah, absolutely. So we really are looking at frequency and duration, particularly when it comes to the physical and occupational therapists. So we'll be actually engaging in a test and learn study in the next month or so that's solely focused on frequency and engagement, particularly with the use of well-known, well-recognized Nickelodeon characters. So we have SpongeBob, Dora, and Teenage Mutant Ninja Turtles. So we're going to be looking at the effect of using those entertainment characters that kids know and love, and how that affects their improvement in physical and occupational therapy. And so frequency engagement are something that's always at the forefront of everything that we're doing, because the more you move, the better you're going to be able to move. And the more frequent and the more, the longer in duration that you're practicing your movements, we imagine that people get better faster when they're moving more frequently and moving for longer durations of time. And that really goes from, people who are well and people who are, looking at overcoming some challenges. But I think we had some questions coming too.
Yeah, and actually that's a great segue for that question for the audience. Thank you, Nicole. The question being, I think you talked a lot about that personalization of movement. Do you have a sense, or will you be providing a sense of how that's related to either age norms or how those movements are associated with particular dysfunctions?
Yeah, absolutely.
Darren, I think
I was going to say Darren.
Yeah, thanks, Nicole. I think the first study that we did, and what we plan on doing with the test and learn, was really to then compare performance that we're getting from these personalized approaches to actually gold standard assessments that are age normed, and give us an assessment of those actual motor skills of those children. And so that first part of the study that I was talking about was to really look at that and see, are these measures closely related to where that age level should be for that child on those particular movement skills. And I think that's a really important point around comparing objective movements to those scores that actually reflect the dysfunction that child's experiencing. And so we were able to also then correlate that with autism severity using another gold standard assessment as well, to look at the severity of that actual autism symptoms that child's experiencing were relating to some of the metrics that we were developing in the system. And so moving forward from that with the test and learn, we're wanting to get all that feedback as well and look at that movement data from individuals, and actually then map that back to our known assessments and known sort of measures that we use in the research and clinic world. So just hopefully that's answered that question.
Thank you. So would that then allow you, in the future, if we think about follow-up studies to the one that's happened, or even with the current product, could you deploy something that is fully virtual in terms of study, or would you still require some of those in-clinic gold standard assessments?
Yeah, that's a good point. I think ultimately with what's been talked about so far, I think is that we've got sort of two avenues, which is a tool which can be used for wellness, but then a tool that can be used by therapists in terms of its therapeutic value. And I think there could be there will always have to be a combination of those two approaches. I think that will need to be validated against gold standard assessments used in the clinic and in research. But I think there is a potential to use a hybrid sort of interventions where you have a mix of standard assessments to begin with and baseline, and then using these types of interventions, personalized interventions, to then monitor and intervene for the patient over a period of time. So I see a combination of both of them, and I think eventually, I mean, there are moves towards having more assessment-based tools within VR and within non-VR environments to be able to actually do assessments using more video game-based assessments that engage children. So I think that will move forward, and we'll have some more access to those types of interventions that can be used within video games that can also engage children that have difficulty keeping attention in these types of long-term assessments.
Great, thank you, Darren. Thank you, everyone, for taking us through that journey.
Thank you.
Thank you.
Thank you, Guillaume. Thank you so much to our tremendous panel. I want to just quickly share with all of you that, you know, our panelists, they can't see the discussion board coming in from the attendees. And I just wanted to share with you from Sherlana, who has already wanted to let you know that she's already downloaded your app and she just can't wait to use it with her children. So I just wanted to share that with our panel. A tremendous bit of news. Thank you so much for just an amazing presentation. I wanted to also thank John Attard, Darren Hawking, Harut Marderosian, Nicole Mosier, Brian Bertha, who, by the way, is a HitLab fellow, if you're not familiar. So thank you again, Brian. And of course, Guillaume, amazing job moderating. Thank you all so very much. Really, really just a pleasure to have you on today.
Thank you, Guillaume. Thank you, everyone.
Thank you.
Thank you, guys.
Thank you again. Thank you, everybody.